Hi, I'm Dr. Hannah. I'm a clinical psychologist, and I want to talk about the relationship between traumatic experiences and unexplained physical symptoms. Have you ever heard the phrase, "the body keeps the score"? In 2014, Bessel van der Kolk released a best-selling book with this title, about the relationship between traumatic life experiences and physical symptoms. This book revealed that there is a complex and multifaceted relationship between our minds and our bodies, especially when it comes to trauma. The mind-body distinction that we refer to whenever we talk about physical health and mental health as separate concepts is completely artificial. Our psychological and physiological states are completely intertwined, and this is hugely relevant when it comes to making sense of symptoms that we refer to as medically unexplained. Medically unexplained symptoms, also known as persistent physical symptoms, have been historically referred to by a range of different terms, including psychogenic symptoms, somatic symptoms, functional symptoms, and conversion disorder. We have come to understand that there's no real difference between physical health and mental health. This artificial separation started with Cartesian dualism, the theory of the 17th century philosopher René Descartes, who suggested that the mind and the body can be thought of as separate entities. And to this day, his theory continues to inform the design of health services, and it completely shapes the way we think about physical symptoms and emotional experiences. You will probably be familiar with the idea that emotions are felt in the body. Think about the last time that you felt rage or fear. How did your body feel in the moment that those emotions were triggered? The nerves and muscles and pathways implicated in physical diseases are not different to the ones that are activated when emotions are triggered. It really doesn't make sense to think of the mind and the body as two separate things. Yet, when we have a symptom that we can't find a physical cause for, we're reluctant to look to psychological factors as a potential cause. Decades of research on trauma and physical symptoms has demonstrated that experiencing traumatic events changes our physiology, leaving us more susceptible to experiencing certain symptoms and even more vulnerable to diseases like cancer and autoimmune conditions. Crucially, our nervous system is shaped by the early experiences we have, and this is expressed constantly in the dynamic relationship between each individual and the world around them as they go about their lives. The ACEs study is a landmark research project that took place in the 1990s. It explored the long-term impact of childhood trauma on health and well-being. They surveyed over 17,000 adults to examine the relationship between adverse childhood experiences, or ACEs, and a range of physical, emotional, and social outcomes. Some of the key findings included a strong correlation between childhood trauma, such as abuse, neglect, and household dysfunction, and a higher risk of developing chronic physical health problems in adulthood, including heart disease, diabetes, obesity, and various other physical symptoms. Other findings included an increased risk of symptoms and syndromes which fall under the umbrella of medically unexplained symptoms, including chronic pain, chronic fatigue, fibromyalgia, and irritable bowel syndrome. They also found an increased risk of mental health problems, many of which involve physical symptoms such as the disrupted sleep and appetite seen in depression. This study demonstrates what psychologists see in practice every day, the experiences we have throughout our lives, and the psychological impact of these experiences is expressed through our bodies. And we don't necessarily have to have experienced what we'd call significant trauma or abuse in our childhoods for our experiences to have left lasting imprints on our minds and bodies. So it makes complete sense to us that some physical symptoms do not have a cause that can be seen on a scan or a blood test. Unfortunately, we are all primed to look for a physical cause for physical symptoms. The enduring biomedical model that dominates our health services emphasizes a physical cause and effect relationship for symptoms, and this shapes how health professionals and their patients approach physical symptoms. It can lead to discrimination, confusion, and even hopelessness when a medical cause for symptoms can't be found. As humans, we crave certainty. And the frustrating thing about unexplained symptoms is that there is often no certainty about their causes or treatments. We're not always able to explain exactly why a symptom is cropping up at a particular time. Each year, there are new and exciting developments in the field that are changing the way we understand the relationship between physical symptoms and psychological factors like stress, trauma, and relational patterns. We are moving towards a model where physical and mental health cannot and should not be separated. There are some fantastic doctors and health professionals out there who are working hard to further our understanding and change people's experiences of seeking help for these symptoms. Yet, the medical system has some catching up to do. Lots of people will continue to have frustrating, even discriminatory experiences in health services until there are enormous changes in how we approach symptoms without a clear medical cause. People may be made to feel as though they're putting their symptoms on, or they may hear unhelpful phrases like, "It's just anxiety," or even, "It's all in your head." As psychologists, we now understand that the relationship between physical symptoms and their causes is not simple. We are continually working to expand our perspectives, evolving our approaches to align with the ongoing paradigm shift in understanding these symptoms. We are fascinated by the relationship between someone's symptoms and the psychological and social factors surrounding them. If we are working with someone living with persistent physical symptoms, we might want to learn more about the environment in which they grew up, because we know this environment lays the foundations for how someone sees themselves, the world, and other people. We'll want to know about how they relate to others, how they talk to themselves, and how they behave when they experience stressful experiences. Although these factors do not traditionally feature in our understanding of physical symptoms, as psychologists, we know that they are actually highly relevant to understanding the complex picture of why someone is experiencing a certain set of symptoms at a certain time in their life. Psychologists have a valuable role in helping people to unpack the complex relationship between their physical symptoms and the psychological and social backdrop for the symptoms. And while this does not always eliminate the symptoms completely, it can help people to develop more of an understanding and lead to a much better quality of life for people living with symptoms that are medically unexplained. In conclusion, trauma can profoundly influence the body, sometimes manifesting as medically unexplained symptoms. By recognizing that connection between emotional and physical health, we can better support people in understanding and healing from the complex interplay of mind and body. Addressing both the psychological and physical aspects of these symptoms is essential for effective treatment and lasting recovery. Hi, I'm Dr. Hannah Sugarman. I'm an HCPC-registered clinical psychologist. You can find me on Instagram at Dr. Hannah Sugarman or on my website at drhannahsugarman.com. I've just finished shooting some videos with MindFriend. Watch this space for more.